Lung cancer is the leading cause of cancer death in our country, but when it comes to surviving lung cancer, early detection is key. Joining us now to talk about it is Dr. James Bauman from Norwalk Hospital. Doctor, thank you for being here.
My pleasure.
I know you've been at Norwalk Hospital since 1985.
1985.
And Norwalk Hospital is ranked high nationally when it comes to lung cancer treatment.
It actually has just received the National Certificate of Excellence for lung cancer treatment. We are the sixth hospital in the country and the first in the New England area that has received this very high honor from the United States government.
That's fantastic. Now tell me just a little bit about lung cancer and how deadly it really can be.
Lung cancer is far and away the most deadly cancer that exists in the United States. 25% of all cancer deaths in the United States are due to lung cancer. About 225,000 people will be diagnosed each year with 160,000 deaths, 50% men, 50% women. The survival rates for lung cancer are horrendous. Most people have a 5-year survival rate of less than 5%. It is far and away the most deadly lung cancer of them all. They are more prevalent than colon cancer, breast cancer, prostate cancer, and pancreatic cancer combined.
Wow, it's a startling statistic. And I think some people think it's just a smoker's problem, but that's not the case.
Absolutely not. Certainly smoking is a high incidence risk factor, and about 85% of people who develop lung cancer are smokers, but 15 to 16% are non-smokers or had never been smokers. The reason for it we're still not clear about.
So early detection is the key here. It's so important. Talk to me a little bit about low-dose radiation screening.
Basically, the quagmire is that for years and years people were dying of lung cancer because the only time they would present is when they were symptomatic or have later stage disease. The early detection of lung cancer where you can do something about it was always ephemeral and never able to be captured. What a low-dose CT examination does, and this has been proven by multiple studies, is that using a CT examination, which most people know either from personal experience or from TV, with the setting set as low as possible to give a minimum X-ray dose. The test takes about a few seconds to do. There are no injections, no needles, no medications. And once the patient leaves, we then have hours to spend and look at a 3D dimensional picture, layer by layer and slice by slice of what exists in the chest.
Now, doctor, who would you recommend get screened for lung cancer?
The classic patient that is known to benefit from it is age 55 to 79 years of age who has what we refer to as a significant smoking history. That's defined by pack years. Pack years means the number of packs you smoke a day by the number of years that you smoke. So, for instance, if you smoke 1 pack a day for 30 years, you're a 30-pack-year smoker. 2 packs, 15 years, 30. Usually the 30-pack-year people are the ones at the highest risk.
Sure. Now, what's the cost for lung cancer screening? Is it something covered by insurance?
Some of the insurance companies are beginning to cover it. It is a slow process. We think it's so important. We have reduced the cost to $150 for the visit. Patients are informed of their results, and the good news is that recently the United States Preventive Task Force, which is the governing body that advises the United States government about the efficacy of tests like this, has just given its formal recommendation that this should be a covered charge for all people in the United States, which is the first step before Medicare, Medicaid, and then insurance coverage will then ensue.
Sure. Well, even at this point, it sounds like it would be money well spent to early detection is key.
If you detect a stage 1 lung cancer, which is what we do routinely, your 5-year survival rate is 70 to 80% versus the more typical one, which is 85% of diagnoses. The 5-year survival rate is less than 5%.
Okay, very good. Well, thank you so much for the information.
My pleasure.
And let's put it up on the screen. You could check out all the information you need here at Norwalk Hospital. Go to norwalkhospital.org. The information will also be on our website, WTH.com. Just click on Style. Doctor, thanks again for being here, and stay with us. More Connecticut Style after the break. We'll be right back.